I'm going to be reacting to Kamala Harris's stepdaughter, Ella Emhoff, talk about her experience with SSRIs.
I'm just sitting here crocheting and waiting for a friend, and I was just listening to this podcast that the Wall Street Journal put out about SSRIs and anti-anxiety meds and kind of the overprescription of them in America. And it was making me think a lot because I've been on SSRIs for over a decade, almost 15 years probably, and they were calling out the lack of research on long-term use of these things. They were calling out the
Yeah, I mean, the lack of research, these drugs have never been studied longer than a year in randomized controlled trials. And so we don't even know if they're effective long term. And Ella is young as well. If she's been on them for 15 years, she was probably taking them during childhood. And we also don't have great evidence in humans about the effects of taking SSRIs on brain maturation during that period. Although we do have two very large primate studies that looked at over 60 monkeys that showed that there were changes in sleep, social behavior, and even brain structure as well.
lack of information that doctors give about coming off of these meds and kind of the psychological effects they can have. And it really got me thinking how little I've thought about that naively, obviously.
You know, Ella, it's not actually naive because you listen to what your doctors tell you, and most doctors say, hey, these are safe and normal and it's no big deal. And so I wouldn't be so hard on yourself.
But I've noticed that every time I've gone off of it for a week or missed it or for whatever reason, like it has been really hard for me and I've had a really hard time.
And a lot of people, they interpret that as them needing the drugs and that they have a chemical imbalance, especially if it happens right when you miss a couple doses and your life didn't get more stressful. You are in drug withdrawal. Your brain needs the medication. You need to come down much slower. That's what's going on.
And I guess this is just something I was wondering if you guys have thought about or relate to or kind of consider when you're thinking about going on meds like that. Because I don't know if this is something that I feel like is being talked about enough.
Ella, you are right. It's not being talked about enough at all.
I feel like so many of us are on these meds and this is like actually happening. Like people get off of them and they kind of break down and it could be really bad. So, yeah, I guess I just want your general thoughts.
So many people are on these medications. About 20% of American women take these drugs. And if you look at women over age 60, it's up to 1 in 3 are on antidepressants. And so it is a really big deal.